Welcome to this presentation of the Carol Bond Health Foods How to Live Longer, Live Better series. Today I'd like to talk to you about joint pain. Joint pain is perhaps the most common affliction associated with aging and is responsible for the erosion of quality of life as we age. Joint pain limits our movements, making even the simplest of tasks nearly impossible to accomplish. The CDC estimates that osteoarthritis affects 34% of all adults over the age of 65. In 2005, an estimated 26.9 million adults in the U.S. had osteoarthritis, which was up 21 million from 1990. There is no known cure for arthritis, but non-steroidal anti-inflammatory drugs, which are also known as NSAIDs, are generally prescribed for pain relief. As with many prescription drugs, NSAIDs have side effects. They can cause sudden heart attacks, kidney failure, liver failure, prolonged bleeding after surgery, and many other more minor problems. If you have lived with the debilitating pain of arthritic joints, NSAIDs' effectiveness against the pain and swelling is worth the danger. A recent study published in the August Journal of Phytotherapy Research has found a natural alternative to NSAIDs that may eliminate the high-risk side effects. Pycnogenol, a substance contained in pine bark, was the subject of the most recent study conducted at Slovakia's Comenius University School of Medicine. 2 previous studies were also done on this substance, and all 3 studies had the same surprising results. 100 patients with stage 1 or stage 2 osteoarthritis were included in the study and were randomly allocated to either a pycnogenol or placebo group. The study ran for a period of 3 months. The established Western Ontario McMaster questionnaire for joint function was employed to rate the pain level and obtain measures of joint stiffness and to what extent the arthritis affects participation in daily activities. Patients were investigated at 2-week intervals over the treatment period of 3 months, and a final time 2 weeks after discontinuation of medication. The joint pain decreased by 40.3% after completion of the 3-month supplementation, and 2 weeks later the pain was still 36.1% lower than at baseline. Dr. Peter Rodewald, one of the researchers of the study, states, "The anti-inflammatory potency of pycnogenol explains the success in lowering joint pain and stiffness for arthritic joints. After 3 recent clinical studies on osteoarthritis, pycnogenol continues to demonstrate its effectiveness for osteoarthritis symptoms, making it a viable, natural, and safe alternative for individuals. The results show a lasting effect after discontinuation, which suggests the anti-inflammatory mechanisms of pycnogenol has allowed the joints to recover." In another study this year, also published in the Journal of Phytotherapy Research, pycnogenol was shown to reduce osteoarthritis symptoms by 56%. In addition, patients required 58% less standard pain medication, which greatly improved the gastrointestinal complications that normally result from NSAID use. Last year, a study in osteoarthritis carried out at the University of Arizona in Tucson, which was published in Nutrition Research, discovered that pycnogenol was effective for improving pain and joint function. After 3 months in the pycnogenol group, there was a reduction of 43% in pain, 35% in stiffness, and 52% in physical function subscales. The placebo group showed no significant scores throughout the entire study. There seems little doubt that pycnogenol can help relieve joint pain and inflammation. But where can you find this naturally occurring substance? Pine bark contains a high level of natural pycnogenol. You don't need to add crunchy pine bark strips to your cereal. You can find pine bark extract available in capsule form. The pycnogenol is extracted from specific species of pine. Not just any pine tree will do. The French maritime pine, which is found in the coastal region of southwest France, is the best source of natural pycnogenol. In addition to its anti-inflammatory properties, pine bark is also a powerful antioxidant. To read more about the healing properties of pine bark, visit carolbond.com and search for pine bark among the over 1,400 supplements that are available in our online store. While there is no cure for osteoarthritis, pine bark can safely help relieve the pain and inflammation and help you live longer, live better.